Welcome to MYA Confidential. I am your host, Krystina Jones, and I am joined by
Chloe Beresford. I am the CEO here at MYA.
We are here to educate and explain about cosmetic surgery. We're going to dispel myths. We're going to change perceptions. We're here to reassure patients who are embarking on or within their journey with MYA. And we are going to have fun. We're going to be speaking to patients, speaking to listeners, allow them to become part of the MYA brand and community. This is a family-owned company. We're approachable.
And we want you to be part of the MYA family too.
And here we are back again, MYA Confidential, with myself, Krystina, and Chloe. And today we are joined by
Dr Vaganov.
Tell us a bit more about what it is that you do for MYA and why are you dressed like that?
Well, I'm dressed like a doctor should be dressed in the hospital. We just finished the list, so I've just joined you after the list. And I've been working as an anaesthetist for MYA for about 9 or 10 years now, quite a long time. And also recently become a responsible officer for MYA cosmetic surgery.
So for our listeners, what does that mean, a responsible officer?
Well, I'm basically responsible for appraisal or revalidation of doctors who work for MYA, essentially. And I just form a bridge between the General Medical Council and MYA as a designated body.
Okay.
Making sure everything's in order,
Something
as a
like
responsible officer should do.
Yes. And there were a lot of words in there. So you spoke about the GMC, the General Medical Council. Yeah. What does that involve, again, for our listeners?
Well, General Medical Council is basically a supervising body, the body that's just responsible for quality assurance in the medical specialty in this country. And they provide the regulation, national regulation, how doctors should be appraised and the quality of service they deliver to the patients is assured at any time.
Okay.
So every organization, basically medical organization or provider of medical services, needs to have a responsible officer who is supervising the process, essentially.
So it goes to show that there's so much that goes on behind the scenes that you don't necessarily think about. There's the legalities. It's not just, here we are, here's your surgeon, let's get on with it.
Not at all. There's a lot more.
Crazy.
There's a lot more to it. And this is why I think it's so important that we talk about how we do things in the UK. Yes. I know obviously there's a lot of people that will be listening to this who are considering surgery with MYA, but they may also be considering surgery with another provider abroad because it's cheaper, because they feel that they're going to get more for their money. But really, what they're lacking is all the extra things that are going on here, all the extra things that we're checking, the safety measures, and the things that just aren't happening abroad. I mean, just alone listening to Dr. Vaganov earlier speaking about how long it was before he was actually able to put somebody to sleep.
Yeah.
How many years of training that has to go on in the UK compared to, say, somebody maybe in Turkey that's only got a few years of experience. How long was your training and what did that involve? And, in the UK, how long would it be before somebody would be putting a patient to sleep on their own?
You're absolutely right. It takes quite a long time. And UK, in some ways, is fairly unique in that respect, I would say. So you do 5 to 6 years of medical school, then you do, general jobs, junior doctor job for about 2 years. Then you select the specialty and you train for 7 years. So basically, for example, anaesthetic training is 7 years, but that's on top of the medical school and junior doctor 2 years. Yeah. So essentially, you're talking about 13, 14 years before you become a consultant. Yeah. And it's only when you become a consultant you're allowed to anesthetize independently. What often happens then is people work in the NHS as consultants, and then maybe in 2 years, once they become more confident doing it on their own, they join private sector.
And it's interesting because a lot of people probably who are listening to this wouldn't even realise that when they are getting put to sleep in the UK, that's actually somebody who's worked really hard for 14 years.
Stringent measures.
Exactly.
Mass amount of qualification.
And they're not realising that things like that are lacking when they maybe go somewhere abroad. It's like we spoke about in a previous podcast regarding aftercare. That is something else that is lacking massively when you go abroad in comparison to here in the UK. And these are the things that patients really have to consider when they are thinking about a procedure, and they have to be very, very careful before making that decision because it is their life.
It's scary. And I know, like, working with you personally as well, we speak to you about patients, their preoperative potential medical concerns. It may be that there's a cardiologist report or medication that they're on. And we talk to you quite openly about that and get that feedback for the safety of our patients, don't we?
Yeah, absolutely. I mean, giving anaesthetic in theatre is only the final sort of event, I would call it. Prior to that, and obviously patients with medical problems, they require more attention. You have to go through the nose. You have to work out how you actually manage them. So it's more of a perioperative medicine rather than actually just giving anesthetic in theatre. And that's why we trained as doctors. That's why we, undergo this broad and long training, so we can actually get experience dealing with patients with different conditions, different ages, and presenting for different types of surgery, which basically then results in a unique combination of things you have to do to these patients to make it safe.
100%.
And this is why, obviously I think we've spoken about this as well. We've touched on it before in previous podcasts, how important it is to have a patient's medical history.
Yes.
Especially for an anaesthetist to really see, are there any problems with this patient? Is there any heart conditions? Is there anything that you need to be aware of to make sure that they're getting the best possible care on the day? Because, in some places, again, they may not be asking those questions. They may not be asking for your medical history. And then before you know it, you could find yourself in a position where, unfortunately, as we see in the press, so many stories where things can end very tragically, for people. And it's really quite disturbing. And the other thing that I was going to ask actually is, what do you do when people are nervous on the day? Because I know when I had my first operation, I was about 22 and I'd never been put to sleep before, and I was really scared. I was, and I really, really wanted a breast augmentation because I'd had my first child, and I was obviously young and everything was great, and then I had a child and things didn't look quite the same as they had before.
We've heard that story.
But my main fear, it was never, what will it look like? Will I like it? Will I not like it? My biggest fear was being put to sleep.
Yeah.
So what do we do here at MYA if we have a nervous patient on the day and she's a bit scared? How do you put somebody at ease?
Well, I think it's important to talk. And, if you see patients like that, it's important to take a bit more time to speak to them and to actually identify the reason they're so nervous, because there is always something. Some patients are afraid to not wake up. Some patients are afraid to wake up in the middle.
Common one,
that was exactly mine. When I was 22, I remember my daughter was only 7 months old at the time, and I was convinced, what if I don't wake up? I was just so worried.
It's mum guilt on another level, isn't it? You're doing something for you, and then you're suddenly like, oh my God, what happens if?
Absolutely.
And it doesn't happen, but it's always at the back of your mind.
Do you give them a little sort of sedation to make them feel?
Yes, you can do. Ultimately, it's an option, but we start by talking to patients, and patients actually tell you at the end, oh, thank you, I feel so much better now, once you've spoken to someone who knows what they're doing. But yes, ultimately, there are medications you can give as well to reduce the anxiety, essentially.
Yeah.
Yes.
How about needle phobias? Because I know that's been one in the past as well.
Well, there are ways of dealing with that. Not everyone is needle phobic. Some people just don't like them.
Yeah.
That's what they tell you, which basically I try to reassure them, basically. And the needles we use for cosmetic surgery, in particular, in the cannulas, are very small in the first place. But there are other things you can do. For example, you can put some numbing cream. Yeah. You can just ask patient to look away when the needle goes in. There's certain other tricks.
That's my trick.
That's the distraction is very good as well. If someone talks to them and just asks them about their children, about their little recent holidays.
That's always what happens.
People barely remember having the cannula.
Well, I remember once as well. Is it gas that's used as well? Because I remember once having the mask. I actually didn't like that. I would actually much prefer
the cannula.
It was an operation once I had actually on the NHS. It was quite a long time ago, and I remember they put was it gas?
Yeah.
And that was a bit of a strange feeling. I think I'd rather have an injection personally.
That's right. I mean, the masks, that people want something, and we can give a mask with a bit of a mixture of oxygen and anaesthetic gas to sedate people essentially right there. But as you said, not all people like it at the end, and it can make you feel a bit nauseous. But it's certainly an option if someone tried it before, especially if someone had a baby and had gas and air. We can use similar things. Well, similar things in theory.
What's your favourite line for them to do when you're putting them to sleep? Do you get them to do the 1, 2, 3s, ABCs?
Where are you going on holiday?
What's your one?
I asked them to think about something pleasant, because I think, something that makes them smile in the end, and it's very individual. Something about the children, just close your eyes, take a nice deep breath, that sort of relaxing kind of breathing. And
so how long does that actually happen from putting the anaesthetic in, your arm feels quite cold, to then sleepy time?
Literally 40 seconds to a minute, I would say.
Oh, wow.
It works quite well. And yes, it feels like a bit like cold traveling up their arm. And sometimes it stings a little bit. But generally, it just feels like cold, and patient drift off to sleep over.
I always think it seems quicker than that.
Yeah.
Because I have actually watched before sometimes. Because I'm not somebody who's really bothered I'm not bothered by needles and things. So I've actually watched before, and I've always just thought, I have no memory after that feeling, like you say, that little feeling. But what would you say then, Dr. Vaganov, to our listeners who are thinking about, surgery here, surgery abroad? What would you say would be your advice to people from a safety aspect? What should they be really thinking about when looking to have an operation in cosmetic surgery?
It's a good question. Of course, I think going abroad has its own risks, and certainly I can say for the UK that the training of anaesthetists is very good, and the regulations here are very tight. So you essentially potentially can go into unknown territory where things can be of very variable standard. And yes, I may have good people, but just no way of knowing that. And when I think it's something offered very cheaply, then you have to question why is that?
100%.
How they're saving, what they're saving on. And, you may have a very substandard care, of course. And there's no way of checking that, essentially.
No, and that's always the way when you buy anything. Sometimes if it is too cheap, you do think, why is that so cheap? It's sort of like there must be something, there must be a catch. And I think the catch is that you're not getting a very good product. And I think it's not only with the anaesthetists, I think it's also with surgeons. Here in the UK, like we said earlier, that we are monitoring surgeons here. There's regulatory bodies in the UK with things like the CQC, the GMC, all these bodies here in the UK that make sure that standards are maintained. Yeah. And I wonder if there's those kind of bodies in places like Turkey, for example. Do you think there is? Do you think they are being monitored?
I'm sure there are some regulatory bodies, but the question is what standards they find acceptable. And
the standards in the UK are obviously very high.
Yeah, they're very high. There's no question about it. And you may come to a clinic which complete abroad, which is fully licensed, et cetera, but actually overall you might find that thresholds for certain things are quite low, and when the UK are fairly high, and people just go into a place and think that it's good, but comparing to, let's say, UK, for example, it may not be that high quality.
Yeah.
Speaking about anesthesia, I would say it's quite safe if you're in good hands.
Yes. And that's the thing, it's elective surgery.
It is elective
surgery.
surgery.
Putting yourself forward for this. Yeah. You need to be safe. You're literally paying for that service. Make sure it's the best.
Yes.
And I think that's the thing about here in the UK is we know that those measures have been taken. And I do think that those final checks, they can't be happening in some places because people wouldn't be dying, people wouldn't be coming home with sepsis, people wouldn't be having such terrible experiences.
They're just pushing the boundaries too much, aren't they? Which doesn't happen here. As we've spoken about with a patient's past medical history, you're aware of that before theatre. If there's anything extra that we need back, we make sure that that happens. And it's that communication that we've all got between the departments too, the clinical, the patient and the hospital. I think that is a great marriage really of it all coming together for the safety of the patient.
Yes, absolutely. As I already mentioned, it's more perioperative management rather than just giving anesthesia.
Yeah.
And obviously, when you go abroad, again, there's a language barrier. There's possibility of some lack of certain expertise. Inability to transfer your medical history over abroad in an appropriate level, and lack of investigations. I think abroad they potentially can just get on with it rather than try and play it safe because they know. Again, I'm speculating, but that if something goes wrong, then you may not be that accountable, really.
Yeah, 100%. You don't know what you're signing for.
Here, you can't escape the consequences.
There's lots of bodies in the UK, governing bodies that are making sure that doctors and hospitals in general, they just can't get away with not doing what they should be doing.
Yeah.
They just don't get away with it. So it's very important.
And I think it's quite nice that I've seen through the years working here, you tend to have anaesthetists that work really closely with certain surgeons. Do you have like a buddy surgeon? Is that how it works? Or certain people you always work with?
Yeah, I mean, I personally work with quite a few surgeons at MYA.
It's because you're fabulous.
Get on with it very well with them.
You have your regulars, don't you?
I do. And yes, it's very helpful actually because you tend to know what surgeons are doing at any moment of time, how they do their surgery, and those little things you can adjust to make it, I would say, perfect, but certainly safe. So there's less chances of things going wrong.
100%. And it's nice that, especially being here in the Welbeck too, that whole kind of community, isn't it? It really is a community here. You've got how it's run with the sisters, the owners of the business, and then coming down into the hospital staff, the clinical staff. Everyone's been here a really long time.
It's like a family a bit here
really
at the Welbeck.
is.
I think that it's like a family. It's a bit like at MYA because everyone says that with MYA. Like it's your anniversary today, isn't it?
It
MYA.
is. 12 years.
Congratulations.
Happy anniversary, darling.
Thanks, guys. I'm expecting flowers, champagne.
Later. So yeah, it's true though. It's like a family, and they make sure they look after you.
Yeah,
and that's what's important. Like Catty said that, her job is when the patient walks through the door, she makes sure that they are looked after and they get that one-to-one care. Are you going to get that if you go on a plane somewhere, like you say, where there could be a language barrier, a few hours after surgery, you're in a hotel room? It's not where you want to be.
No. But even saying that about language barriers for patients that we have here where English isn't their first language, we always make sure that we have a translator, and they're even there for your part, aren't they? Because it is so important that the patient's aware of the risks, the complications, how everything's happening, and that their expectations are there and they're set up for the day. I think that's really important too.
Oh, absolutely.
Yeah.
We would always make sure there was an interpreter there on the day of the consultation with the surgeon and then on the day of the operation as well. I think we should also have a little chat whilst you're with us today, Dr. Vaganov, about pain relief. Because obviously this is something that comes up again and again with patients. They talk about, will it hurt? How much pain will I be in? What's the recovery like? And obviously it's very different for everybody. I was just joking earlier about how my sister and I are so different. I'm a bit more of the tougher one out of the two of us, and she's always reaching for the painkillers. So how do you manage that when a patient comes round after surgery? Do you talk to them about how they're feeling, and how would that be managed?
Again, I can't emphasize more the preparation before the surgery. So I think people who are better informed about what to expect, they definitely deal with pain and other potential minor side effects much better. Pre-warned is pre-armed, essentially. And psychological preparation, communication, again, even on the day of surgery, it plays an important role. Reducing anxiety, because it's certainly a very important factor that increases the pain or reduces the pain threshold, whatever you want to look at it. So once you've done that and reduced the anxiety, you've already scored some points towards better pain relief.
Okay.
And then, of course, there's a variety of medications. Surgical technique is also very important. So,
oh, really?
Absolutely, yes. And surgeons who use appropriate amount of local anesthetic put it evenly in the wounds, and the pain is much better.
Yeah.
Clever.
Do you know, I've often thought that because some people do say that, don't they?
Yeah.
Oh, I had such a straightforward operation, and somebody else can have the same one and they're, not as comfortable.
Yeah.
I actually find that going over the muscle is not particularly painful. Everyone I know, I'm over the muscle, and everybody I know who's over the muscle seems to recover very quickly within, I think I only had maybe paracetamol when I came home.
Yeah, it's possible.
And I was just a couple, maybe 2-3 days. Even with my uplift, I remember somebody saying to me, the uplift was a little bit more painful. But I didn't find it painful.
Same, because we're in front of the muscle, isn't it?
Yeah.
It's definitely going to be a hell of a lot more when it's behind. You're then having more stretch to it as well. There's more trauma, isn't there? You must have seen a lot during theatre.
Yes, and actually there are medications we can use. We're not strictly speaking painkillers, but they help reduce the tension in the pectoral muscle and reduce the pain. And we prescribe it pretty much to all the patients nowadays.
Yeah.
The more you do this type of surgery, the more you learn about what's the best way of relieving this pain.
Yeah, of managing it, yeah.
And we're always prepared to titrate. I mean, we use pretty standard dose in some way based on patient's weight, but subsequently we use a different combination of medications to keep them comfortable. And education of how to manage it afterwards. And it's not just medications. I mean, breathing, relaxation techniques.
And that's the
massage,
beauty about somewhere like MYA, I think. When our patients come here, we look after them. We make sure the pain is managed.
Yeah.
Even if somebody is really unwell or they feel poorly after the anaesthetic, we'll keep them in overnight.
Yeah.
We go that extra mile. Whereas I think, obviously, like I say, going abroad and things, you may not get that as an option to stay in a hospital a bit longer until you actually feel okay to leave.
And that's scary because you're just being shipped off, aren't you?
Yeah. Especially after
care.
a big, a more major procedure, maybe like a tummy tuck or, full body liposuction, something like that, where it's actually having quite a significant impact on all over the body, how you feel. Just to suddenly find yourself being turfed out.
It's horrible.
And that's the kind of stories that you read in the press.
Yeah.
Even people, I think, on the plane, I read something about somebody on the plane after, I don't know whether it was some liposuction or something, having their drains still in on the plane.
It's disgusting.
I know.
It's so unsanitary.
Well, you just can't imagine, because obviously here, you'd be in the hospital, they'd be removed and, everything would be taken care of. So it's a bit insane to think about.
And I think it's kind of like dispelling those myths to patients. That is not normal. That should not happen. Yeah. It should be done clinically, sanitary, with that aftercare throughout, and having that knowledge from your clinicians all around you throughout as well. It's scary.
So tell us a bit about antibiotics after a procedure. So why would a patient be given antibiotics? What are the benefits of it, and why is that?
So yes, antibiotics are pretty universally given during the procedure before the incision is made. It's a standard practice. Subsequently, depending on the surgery, depending on the patient's characteristics, the decision is made individually whether to continue antibiotic prophylaxis. Obviously, the push is now to try and reduce the use of antibiotics. And we're certainly very aware of that. But equally, we don't want to have any patients who develop the infection, so it has to be tailored individually.
So if you were to have, say, just a straightforward breast augmentation, would a patient be sent home with antibiotics as a precaution? How would that work?
Depends on the surgeon, I would say, very much, and it still varies the practice. I think the trick in cosmetic surgery is that people don't want to have an infection. I mean, we're really striving not to have any infection because it will have an effect on the overall outcome and the look. So I think they certainly have a much lower threshold of continuing antibiotics postoperatively. But I think practice varies. Some people just give one dose prophylaxis. Certain surgeons will extend it for a few days afterwards to reduce the possibility of infection. Certainly in the bigger surgeries, I witness surgeons extending the antibiotic prophylaxis for much longer than just one day.
Yeah, things like tummy tucks and things like that. I think sometimes you can have that like extra.
Yes, definitely. That's a good example. For example, mastopexy or breast reductions. When there's a massive tissue damage. There's,
and it's a large area, isn't it?
Correct.
It's a lot of there's a larger wound to heal, and obviously if you do get an infection and delayed healing, it just it takes its time. Whereas if you have the antibiotics, you're kind of avoiding the possibilities.
You're reducing the possibility to an extent. Obviously, that has to be weighted against the risks of giving someone extended course of antibiotics, because antibiotics can cause bacterial resistance and there are other side effects of that. They are medications, so they're not without side effects. And again, as I said, it's just using a clinical judgment in the end of the procedure to decide whether to continue antibiotics or not. And that's often left to surgeons, sometimes to anaesthetists, just to make a decision on a day.
So, Dear Maya is a segment that we do during our podcast. Patients will write into us, DM us on Instagram, etc.
It actually sounds like we're an agony aunt when you say Dear Maya.
We are.
Could we?
You are our honorary agony aunt for today, Dr. Vaganov. Congratulations.
We say it reminds us of morning television when people used to phone in and talk to the agony aunt. And we have all these patients, Dear Maya.
Right, so I do have a Dear Maya for you that is quite anaesthetic specific. Patient has said that she's looking into having liposuction, and what's the difference in having it with a general anaesthetic versus the local anaesthetic and sedation, or it could be known as twilight. How does that differ?
So essentially, general anaesthetic is general anaesthetic. It's just what we've described earlier. You put a cannula, you give you medications, you have to sleep, and you wake up. You're not aware of anything, you don't know what's going on, and time just flies. You're literally in and out of the sleep. Twilight, or sedation as we call it, is another form. The main difference, I would say, is that sometimes medications are very similar. So you probably get less of anesthetic medications, but we use certain similar intravenous medications to keep patients sedated. But sedation is basically you just reduce the sensory input, reduce your brain's ability to perceive certain things in a certain way.
Okay.
So confuse your brain, as you can call it.
But are you awake then?
You kind of semi-awake, semi-asleep. And I always tell my patients, you may remember something, but it shouldn't be an unpleasant experience. So certainly memory is affected, so you probably won't remember much, even though sometimes people respond to voice and, obeying commands under sedation or twilight anesthesia. They have no recollection of that later on.
Could they feel something though? Would they maybe say, oh, I could feel that? It might not be like pain as in, pain if they were wide awake, obviously, but would they be like, oh, could they talk? How is that?
Yes, it can. First of all, sedation levels vary. So you can have a very light sedation where people literally given some strong painkillers and a bit of sedative just to reduce the anxiety. I would say that is reserved to the procedures where surgeon can put a lot of good local anesthesia and basically reduce any pain to a minimum. And then you have a deeper sedation or deep sedation where patients are almost anesthetized, but still sort of breathing on their own, sometimes moving a little bit, but certainly asleep visually. Yeah. And there's something in between. So it's really dictated by procedure and how people respond to ongoing procedure during that procedure itself. Quite often it's people can even respond to you and move.
Is this more at a patient's request? So would this be done more rather than a surgeon's appetite to do a procedure like that under just sedation? Would it be more that a patient said, I really don't want to be put to sleep. I just want to be sedated for this. It's important to me. I want to be aware, but I don't want to be able to feel anything. But I still want to have that level of consciousness.
Absolutely. I mean, some patients, they may have had some bad experience with anesthetic, and usually we're talking about nausea, for example.
Feeling poorly.
So if you have a full general anesthetic, you're more prone to have nausea. If you're having sedation, the chances of you having nausea are much less. I would say. Plus recovery. Recovery after general anaesthesia is inevitably longer.
Yeah.
Because you're given stronger drugs and large quantities, and that make to keep someone asleep. So recovery is longer. While after light sedation, people can literally go home in 2-3 hours.
Well, it's a bit like when you go to the dentist, isn't it?
Yeah.
Sometimes you can be given sedation at the dentist, and then you almost get up off the chair, go home. So I suppose it's that sort of quick turnaround. So you've actually had both, haven't you, Krystina? You've actually had, obviously, your last procedure with your reorg uplift was under GA, but then before that, you've had lipo done under Twilight. So
back in the day, yeah. I think if I were to have lipo again, I'd go for the general anaesthetic just for ease. I think it's just easier to be asleep personally. But again, it's all down to the patient's preferences, and we offer both with some of our liposuction surgeons as well.
Yeah.
And you have the option there to discuss it with the anaesthetist too. So it's nice to have that option, I think.
Yeah. And it's also, you know, if there are people who are worried and concerned out there and they feel that they can't do it because they are worried so much about being put to sleep, obviously we have a team here at MYA.
Yeah. And you can see that the anaesthetists are approachable.
Exactly.
They're real people.
And they're happy to talk it through and put people at ease, which is amazing.
And that's what we wanted to do for this podcast. We wanted to be able to make things relatable. You are a human, you're relatable, you're an anaesthetist, but it's going to stop those fears, squash those doubts, and make the patient feel more reassured.
And also educate the patient as well, because it's amazing how many patients don't really know some of the stuff that we're talking about, you know, with regards to people, you know, putting people to sleep in, say, Turkey. They may not really have the amount of years experience that you would really want a doctor to have that's putting you to sleep.
100%.
And it's all those different things that you've got to take into consideration when making a decision. Obviously, when you're choosing a provider like MYA, you know that you're going to have the aftercare, and you know that the team there, especially here today at the Welbeck, where we've got such a lovely team, you know that they're going to take care of you, which is the most important thing.
And that's it. Patients, do your research. And on that note, thank you so much for coming, Dr. Vaganov.
Pleasure. Thank you for inviting.
Lovely to have you. Hopefully we'll have you again on our
You're always
podcast.
Welcome. Thank you.
We'll maybe have a surgeon as well.
Yes.
On one of our next ones, talking through some procedures. So,
stay tuned, guys.
Yeah. Until next time.
Thanks everyone for listening. Please hit the like and subscribe button.
And please follow us on all of our cosmetic surgery social media channels.
At MYA Cosmetic Surgery. You'll find us on TikTok at MYA Cosmetic Surgery. Share this episode with a friend and anyone that you think will love it.
Thanks, guys.
Bye.